Good morning, everyone. I'm your NCLEX tutor, Annalise Garrison, and today we're going to talk about how to know the different effects of medication. This is what I originally started to talk about, but I added a couple things. I just needed to get a video up because I am currently tutoring some students and they need this video. So let's take a look at the different effects of medications. There's actually different ways you treat the different effects. So let's learn that. In starting, I just wanted to let you guys know that there's absolutely no way you can know all the medications. Did you know that there are 60,000 medications available in the United States for healthcare providers to prescribe, and there's another 20,000 over-the-counter medications that our patients can actually buy. And that doesn't say anything about the herbal concoctions that we all come up with, and not to forget illicit drugs. What I want to do with this presentation is to explain to you the different kind of effects that you would expect from medication and how to handle that. So the very first effect of any medication, of course, is the intended effect. This is what the medication is actually intended for. Something you would expect to happen with this medication based on its action. So it's very important for you to understand the action of the medication so that you can spot the changes. Right? Now, the nurse's role in the intended effect of any medication is to monitor for therapeutic levels, labs, vital signs. Right? So, this is what we would do for intended effects. For side effects, what are side effects? These are unintended negative reactions to a medication. The nurse's goal in side effects is to take measures to alleviate the discomfort that this medication is causing. Right? That's the goal of the nurse. When a patient has a side effect, is to alleviate the discomfort. The third kind of effect is adverse effects. These are always harmful, negative reactions, and they're always undesirable. These effects can range from mild to severe. The nurse's role in adverse effects is to the focus here is to stop the medication and to figure out what is causing the reaction, and always, always, always call the healthcare provider when a patient is experiencing adverse effects. And then the fourth effect is toxic effects. Toxic effects are harmful, potentially deadly reactions when a medication exceeds its therapeutic levels. So you must always report toxic effects to the healthcare provider. And toxic effects are often identified by monitoring blood levels for therapeutic range. Don't forget that. And of course, if the patient passes out or becomes confused or something like that. So, the nurse's role with adverse and toxic effects, always stop the medication if you see a question like that on the NCLEX. The goal for the nurse with the side effect is to alleviate the discomfort. What is causing that side effect? and to alleviate it. And of course, intended effects. Intended effects is good. That's what we're giving the medication for. And also for the NCLEX, guys, always monitor your vital signs for all four of these different types of effects, whether it's intended, a side effect, adverse effect, or the toxic effects. Because even though we're going to call the doctor, he's going to want to know the vital signs, and you might even want to do a quick neurological check. Pain, you have that information ready when you're calling the doctor. All right, let's go to the next slide. Well, everyone, the time has come. The next generation NCLEX is here, but you don't need to worry. I will help you with one-on-one private tutoring. I will help you with your next generation care plans for those of you who need that. And I will also help you with your student writing assignments. Don't delay. Call today. I've been helping nursing students since 1997. So, for those of you who struggle with your pharmacology questions, I want you to know that there's different kinds of questions, guys. NCLEX pharm questions may include medication administration procedures, one of the four effects that I just talked about, right? Blood and blood products like blood clotting, a lot of times, PTT, peripheral nutrition, don't forget your, tube feedings and stuff like that, your CVA access devices, dosage calculations. So if you need help with dosage calculations, don't forget to tell me that. Pharmacology, when I tutor pharmacology, that actually takes quite a bit of time, at least 4 tutoring sessions, if not more. So that really is, pharmacology really is an individualized tutoring thing. Tutoring session. So, talk to me about that if you don't know your dosage calculations. Don't forget your IV therapies and also your pain management. So, just be cognizant of the fact that the NCLEX Farm questions may include all of these areas, not just the one area that you're having struggles with, which you may be struggling with the 4 side effects and how to handle that. You may be struggling with the actions of the medications, which is a whole nother video, how to study for a medication if you don't know the medication. But again, in this video, actually, let me give you some classifications. Let's talk about that a little bit. I wasn't planning on doing this, but yeah, let's talk about the classifications for a minute. Alright, so it's important to, if you can take a medication and know if it's a blood pressure med or a calcium channel blocker or an ACE inhibitor or antiviral, that'll make it a lot easier for you. Now, the picture you see in front of you is not mine. It's a cheat sheet from Mama Trick's text preparations. If you can't read it, it is on my community wall, okay? So just know that you could probably get a better picture of it on my community wall on this channel. But alright, so let's look at blood pressure medication. See, if you know it's a blood pressure medication, put it in the blood pressure section of your study guide, right? So ACE inhibitors, what do? They are used to treat hypertension and heart failure. And most of the meds in your ACE inhibitors, for example, end in PRIL. Beta blockers, we know that's a heart medication too. And what does that do? That's used to treat hypertension and angina and a whole variety of dysrhythmias. Now, your beta blockers, we can spot them because they end in LOL. You see? So if you know this, it'll be a big help to you. Now, what we're going to have to do with this portion of the video is just pause it, like when I talk about each different classification. The next class, because I do realize I'm going a little fast, but if I sit here and explain it all, it's going to be a 3 hour video, right? The next classification is calcium channel blockers. Most calcium channel blockers end in PINE. And what are calcium channel blockers used? They're used to treat hypertension, chest pain, and again, dysrhythmias. Um, Most medications in the cardiac system do this work the same way. You just got to know, what different. There's so many, right? And then we have our angiotensin 2 or receptor blockers. Now, what do? They inhibit blood vessel constriction, helping blood vessels relax, which lowers blood pressure. And they end in SARTAN. All right? Now, let's go to our sorry, I can't make this any bigger. Like I said, check my community wall on the channel and screenshot it, and you can read it better on your phone. Um, don't forget, guys, additional cardiovascular medications that do help with the heart, yes, but they do additional therapeutic things like your potassium sparing diuretics. They increase fluid excreted by the kidneys while retaining potassium in the body. They reduce cardiovascular congestion, so they're used for CHF, right? And they reduce edema. And most of these meds end in ACTONE, actone. Then you have your thiazide diuretics. They end in THIAZID. What IDE? What do your thiazide diuretics do? They reduce cardiovascular congestion and edema that results from CHF. Basically the same thing. Don't forget your antilipidemics. Now, what's an antilipidemic, right? It's a cardiac med in a way, in that it reduces cholesterol. That's the main thing. Reduces cholesterol. And they end in STATIN. And then you have your thrombolytics. What do your thrombolytics do? They're your clot busters, right? So your thrombolytics end in ASE. All right, these are all considered cardiac meds in a way, but they have other redeeming properties. All right, let's go to the next slide. Like I said, if take your time, take good notes, because we're going to be studying this when I tutor pharmacology. I just noticed this, and I want to say this before I move on. They don't have nitrates up on the board. Your nitrates promote vasodilation, and they're used to treat angina. That's the main thing you give for heart attack patients, right? Nitro. So make sure you write down nitrates promote vasodilation, and it's used to treat angina. I don't know why that's not on the board. All right, let's talk about your antibiotics. I'm looking at their notes and my notes, guys. So, there's quite a lot here. So, let me see here. All right, let me talk about some that are not on the board. Your antiviral medications contain the letters VIR and are used to treat immuno problems and also HIV, right? So don't forget your antiviral medications. I don't see that on the board. I also don't see the benzodiazepines, which end in the letters PAM for the most part. Now, what do benzodiazepines do? They're anti-anxiety meds or muscle relaxing meds or anticonvulsive. They also have anticonvulsive effects, right? So, So that's important. Don't forget your anticonvulsive with the benzodiazepines. Let's see. Well, everyone, the time has come. The next generation NCLEX is here, but you don't need to worry. I will help you with one-on-one private tutoring. I will help you with your next generation care plans for those of you who need that. And I will also help you with your student writing assignments. Don't delay. Call today. I've been helping nursing students since 1997. As I go along, please stop the video and take notes because not everything I'm saying is posted on my community wall. But if you look on, again, number 2 there, it says antibiotic medications. Antibiotic medications. Remember when you're studying your antibiotics that it depends on the bacteria, the type of bacteria it is that the doctor will prescribe the medication. Now, bacteria can be gram negative or gram positive, but with broad spectrum antibiotics, these are antibiotics that the doctor gives because he or she does not know whether it's gram negative or positive. We have our tetracyclines, and these meds end in Cycline, and then we have our aminoglycosides that end in MYCIN or MICIN. And then we have our fluoroquinolones that end in FLOXACIN. Alright? Look at again, please look at the community wall for these specific antibiotics. I think it important too to bring up another classification here. Your glucocorticoids and your glucoid steroids. Alright, these medications alter the normal immune response and suppress inflammation and are used as replacement therapy for adrenal insufficiency, and most of these medications end in NOSE. This is not on the list, so please, back up a little bit or, take notes as you go along. Also, under your gastrointestinal medications are your histamine H2 receptor antagonist, or you might know them as H2 blockers. These types of meds suppress the secretion of gastric acid and alleviate heartburn, prevent ulcers, or are used to treat GERD. And most of these medications end in TIDINE. All right. GERD is pretty common. Also, don't forget your protein pump inhibitors. They suppress gastric secretion and are used to treat ulcer diseases and things like epiglottitis and stuff like that. And most of these meds end in ZOLE. Alright, we're doing good. Now, under respiratory medications, we have your antihistamines. Now, antihistamines are usually used to treat allergies, and they end in INE. Most of them end in INE. Of course, Benadryl is a well-known antihistamine, used to treat allergies. So, you see, there is some exception to the rule. And then bronchodilators usually end in LINE, like albuterol, That's the main one, albuterol. But there's others, and there's they end in line or terol. They dilate the bronchi and the bronchioles so that we can breathe easier, right? They dilate the airways. So, with the um, respiratory meds, they're mostly used to treat asthma and COPD. Not on the list you see in front of you is thrombolytic medications. These thrombolytic medications are used to treat to dissolve blood clots, and they usually end in ASE. Don't forget your thyroid hormones medications. These medications are used as a replacement therapy and used to treat things like hyperthyroidism. And most of these medications contain the suffix THY. All right, I just wanted to mention those two before I go on to the depression or anxiety medications. Um, Meds such, oh, I already mentioned the benzodiazepines used to treat anxiety and prolonged depression, and these meds end in PAM or LAM. All right, you have your antidepressants that end in well, I gotta tell you, antidepressants are, there's a lot of them out there on the market, actually. But the most common ones are your tricyclic antidepressants that are TRIPYLINE, right? Now, the tricyclic antidepressants that end in LINE are used to treat bipolar disorder, anxiety, OCD, and other mood disorders. So, and don't forget, as far as the mood disorders goes, your anticonvulsants are often used as mood stabilizers, okay? That's just a little side note. And then we have our serotonin reuptake inhibitors. People that have depression lack serotonin, right? So these types of meds delay or block the reabsorption of serotonin used to treat major depressive disorders and anxiety disorders. Okay, these are the serotonin reuptake inhibitors. I think I just said that if you have depression, you lack serotonin. You have too much serotonin. I misspoke there. So most of these meds end in PRAM or INE, okay? That these are your depression and anxiety medications. And lastly, let's talk a little bit about your anesthesics. All right, local anesthesics, and in CAINE, we all know what that is. That's for pain. So, like lidocaine. All right, then you have your corticosteroids. They end in SONE or LONE. What do? They're your anti-inflammatories. I kind of already mentioned them. Then we have our uh, sulfite, sulfides. Hold on just a second. So our sulfamides, again, suppress bacteria growth and are used to treat bacterial infections. And they usually contain the suffix SULF. Guys, there's a lot of medications out there. There's a lot of suffixes out there. You can't possibly know them all. Again, I said there was 60,000 medications that the doctor could prescribe. There's another 20,000 you could buy over the counter. But these are the most common classifications. If you listen to this video again and write down these classifications, these should be a huge help to your pharmacology studies. Alright, I'm going to go ahead and stop this video here because it's already over 25 minutes. Please look for another video where I go over some questions, pharmacology questions, and some more tips for how to study for your pharmacology questions, guys. Pharmacology is difficult. Reach out to me. I will be able to help you more in depth. It really takes some tutoring time in order to help you. Alright, God bless, and I'll see you in the next video.